Hospital care is being replaced by outpatient care. Outpatient care is being replaced by home care. Patients want to be treated and recovered in a more normal and less expensive environment. This is a permanent national trend. 200,000 hospital beds have been closed in the United States over the past 25 years. Cuyahoga County lags the nation in this regard. We have more hospital beds per person than almost any city in the country. We've added beds even though hospital admissions are flat. This affects hospital occupancy. Hospitals work most effectively at 85% occupancy. Local occupancy fell over the last 4 years from 74% to 68%. New beds will be added in 2011, which will drop the occupancy to 66%. Healthcare has moved also from an individual practice to a team sport. The solo practitioner has become a historic figure. Cleveland Clinic started with small teams. Our Department of Thoracic and Cardiovascular Surgery had 2 surgeons in 1956 and a handful of nurses and technicians. Today, the cardiac team includes hundreds of physicians and support personnel. As procedures and care become more complicated, teams require more specialties. The recent face transplant at the Cleveland Clinic is an outstanding example of teamwork. There were 11 specialties involved in that procedure, including bioethicists and psychiatrists. Teamwork is changing the face of physician employment. Solo practitioners are challenged by the explosion in medical knowledge and the complexity of running a business. Last year, for the first time, more physicians were employed by hospitals than were self-employed. The recent healthcare debate has highlighted the skyrocketing cost of healthcare in the United States. Healthcare costs were more than 17% of the GDP in 2010 and will shoot up to 18% next year. Average individual spending grew a remarkable $8,000 per person in 2009. This has sent the cost of employee insurance premiums through the roof. The average family is paying $4,000 per year. Clearly, this growth rate and the cost of health care is unsustainable. We are facing new challenges. The current solutions are not working. Michael Porter, professor at the Harvard Business School, wrote, "Innovation is the only true long-term solution to high-quality, affordable health care." Cleveland Clinic was founded by innovators and medical pioneers. In 1921, at the dedication of the Cleveland Clinic, one of its founders, George Cryle, stated, "Our institution is designed to meet a public need in a more flexible organization." Cleveland Clinic has had an innovative structure. It is a not-for-profit group practice with physician leadership. All physicians are on salary. There are no bonuses or financial incentives. All physicians are subject to annual performance reviews and are on a 1-year contract. To date, I personally have had 35 one-year contracts. I'm looking forward to a 36. The motto of this group practice is to act as a unit. Its success can be measured by its growth. We now have 2,700 salaried physicians and scientists, the second largest group practice in the world. We continue to innovate our delivery system. 3 years ago, we changed our organizational structure. We abandoned the typical profession-oriented organization designed around physicians' competencies, such as surgery. We created a patient's needs orientation approach, such as the Heart and Vascular Institute. We're the only hospital to be completely organized around patients' needs. Each institute is based around a single organ system or disease. Medical and surgical services are combined under a single leadership in a common location. Our Heart and Vascular Institute includes cardiac surgeons, cardiologists, vascular surgeons, and vascular medicine, all co-located in the Sedell and Arnold Miller Family Pavilion. Institutes put patients first. They promote innovation and the efficient use of resources. They represent teamwork at its best to solve complicated medical problems. The demand for doctors is growing nationwide as people are growing older and the population is increasing. More people will have coverage through health care reform. It is estimated that America will need 860,000 doctors to meet its medical needs in 2025. Projections show that we won't have anywhere near that number. The supply will fall 125,000 doctors short. We'll need to rely on mid-level providers, nurse practitioners, physician's assistants, and certified nurse anesthetists. Cleveland Clinic has a 40-year tradition of using mid-level providers. We have 80 mid-level providers supplementing physician care and cardiac surgery alone. We're experimenting with other ways to extend physician services. Shared appointments are an innovative way to fill the gap. These visits begin with a patient seeing a doctor alone, followed by a group session with patients who have the same condition. Shared visits are an excellent resource for patients with diabetes and other chronic diseases. There's also a worldwide shortage of nurses. The United States nursing deficit is expected to be 1 million by 2020. We are relying more on technicians to take up the slack. This has been very successful. At the Cleveland Clinic, technicians now perform 40% of the nursing labor in our operating rooms. One of the biggest operational challenges, however, in healthcare is to align locations with patients' needs. This means having the right facility at the right time for the right care. Cleveland Clinic's answer to this challenge is our integrated delivery system. This system provides the full spectrum of care using 115 locations. The simplest unit of the system is the Minute Clinic. There are 9-minute clinics at location pharmacies supported by the Cleveland Clinic personnel. They offer basic care for minor ailments. The system has multiple tiers. Each tier is a step up in complexity and acuity. The next level is our 16 family health and surgery centers. They offer primary and specialty care and same-day surgeries across the region. We are in the process of building 2 new facilities to serve Avon and Twinsburg. We are particularly proud of the Huron Community Health Center. This is being built in East Cleveland. This concept was developed with community leaders, and it represents the leading edge for chronic care. It is planned to meet the special needs of this urban community and to reduce the need for hospitalizations. Our 9 regional hospitals provide routine hospital care for their communities. The main campus of the Cleveland Clinic is the upper tier of this system. It has become a very high-tech facility to treat complicated conditions of very ill patients. Currently, its patients have the highest average severity of any hospital in the country. All of our facilities are linked virtually through an electronic medical record system serving 6 million patients. It is possible to have your medical record go electronically from a family health center to a community hospital to the main campus and back. President Obama noted Cleveland Clinic has one of the best health information systems in the country. This virtual network is matched by a patient transportation network that can go anywhere in the world. We have ambulances, helicopters, and fixed-wing aircraft. 12,000 patients were transferred last year to the main campus. This included patients from 35 states and 16 different nations. We are utilizing resources more efficiently by consolidating several services to create centers of excellence.